And just the second part is just, and I'm sorry for not having sent these questions to you earlier, but I trust you're quite an expert in bipolar disorder. So, but we had some of our members and friends asking some questions about your study and some general questions about bipolar disorder. And I gathered some of the best questions. I mean, some of them are chicken and egg questions. But maybe we can spend a few minutes thinking or talking about them, if that's okay.
Certainly.
Uh, okay, a very general question about bipolar disorder from Hrisa. Uh, it has to do with the cause of the illness. I mean, is it nature or nurture? I mean, is it genes or the environment that it's actually causing the bipolar disorder?
Okay. Well, I think when we talk about mental disorders generally, actually, and even physical disorders as well, there's a lot of evidence emerging over the last 10 years or so, particularly, that actually the old debate about whether disorders are caused by nature or nurture is really becoming slightly outdated, because it's very difficult to actually think of any disorder that is completely environmental or completely genetic. Well, the number of disorders that are probably much fewer than we used to think. And the vast majority of mental disorders, in fact, I would say probably all mental disorders, they're multifactorial disorders where the risk for them is an interaction between genetic and environmental factors. So that what probably happens is that your genes or your genetic makeup make you vulnerable to certain environmental risk factors. And if you have particular genetic variants and you also are exposed to the environments that impact on those genes, then you are more likely to develop bipolar disorder. But when we look at the association between twins of bipolar disorder in twins, when we compare the chances of having bipolar disorder if you have an identical twin who's got it, or if you have a non-identical twin who's got bipolar disorder, when you compare those, you can get an estimate of the heritability of the disorder. And most estimates show that to be about 85%. But that doesn't mean that environment is not important as well. As I say, it's probably interacting with genetic risk.
But it's 85% if you have an identical or non-identical twin, right? I mean, it's not. This heritability rate is not the same if, let's say, someone in your family or in your background used to have bipolar disorder, then the genetic risk is quite greatly reduced.
That's right. I mean, it is still the biggest risk factor we know of is having
family
a
history. Yeah.
So if you have a first-degree relative with bipolar disorder, which means a brother or sister, or a parent, or a son or daughter, then your risk for bipolar disorder is roughly of the order of about 10 times more than it would be in the general population.
Okay.
So that's we've just been talking about my study, which showed that getting a lot of A grades means you're about 4 times more likely, but having a brother or sister with bipolar disorder makes you 10 times more likely. So you can see that that's a much stronger risk factor.
And just a related question by a member of our anonymous forum, Rev83. I mean, who else would would be quite likely to develop a bipolar disorder if, let's say, we don't take into account heritability, we don't take into account the genes.
If we ignore the genes, you're asking me what are the environmental risk factors for bipolar disorder?
I think she was trying to get to that with her question. I mean, if let's say you don't have genetic risk to develop the illness, I mean, are you likely to develop it at all? And if so, what may cause it?
The environmental risk factors for bipolar disorder are not as strong as the ones for some other mental disorders like schizophrenia. So there's some evidence that taking drugs might increase your risk for bipolar disorder, or at least that people with bipolar disorder are more likely to have a drug history. So I think if there was one thing I would point to that is a modifiable risk factor that you can actually that you can influence yourself, influence your own risk of bipolar disorder, which of course you can't with genes because you're stuck with the genes you're born with. And then it would be drug use. People should try to abstain from drugs or reduce their risk of psychosis and probably of bipolar disorder.
And I think stress and adversity in general, I mean, is likely to predispose to developing all kinds of mental disorders. I think which would include bipolar disorder as well.
Yeah, that's probably true, and certainly stress is very important in precipitating episodes of bipolar disorder, because bipolar disorder is an episodic illness where you have episodes of depression or mania and periods in between when the person's quite well, and often the episodes of either mania or depression are triggered by environmental events and stressful events like bereavements and things of that type.
Yeah, and events that dysregulate sleep patterns and dysregulate social rhythms, isn't it? I mean, that's as psychologists we tend to look at this a bit
right.
more. But these tend to actually more affect the course and the expression of the illness rather than actually causing
the expression of the illness rather than actually getting the illness in the first place. That's probably correct. Yeah.
Okay, I've got two more very interesting questions by Margarita. Can education help people to cope better with the illness?
Yes, I think almost certainly it can, and there's some evidence from various sources, but particularly from some Spanish research groups who've looked at psychoeducation as a way of perhaps not so much preventing bipolar disorder, but in those who already have bipolar disorder, in trying to prevent relapses. So these include, for example, monitoring your symptoms so that when you have particular symptoms which in the past have triggered an illness, such as losing several nights' sleep in a row, for example, that's a common one. Then the person then becomes alert to the fact they may be about to go into an episode of disorder, and they might then go to their mental health clinic, perhaps increase their medication, and so on.
So you think people who are better educated are more likely to learn quicker about their early signs and cope and respond better?
Yes, I suppose that's probably right. Yeah, I really meant education in the sense of educating patients who have the disorder in managing their illness better.
Okay.
But I think perhaps you were talking about level of education generally.
Yeah.
Right. Yeah.